Nausea sucks. Yes, I know. I've been nauseated. My wife's been nauseated. It is not a fun experience to have whenever you're nauseated. So in today's video, I'm going to go through 5 reasons why you're having nausea. We'll discuss 5 workups you should do or have your doctor do for nausea. And at the very end of the video, I'm going to give you 5 recommendations I have to get your nausea taken care of. 5, guys. Let's talk about food. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating all sorts of patients with nausea issues. I published multiple papers on the GI tract and in gastroenterology. If you live here locally, come see us up at Gastro. We can find exactly what is going on with your nausea. So why are you nauseated? There are 5 reasons why. So number 1, and we have to rule this out, you actually may be pregnant. I know it's shocking to hear this, but anyone, any female, unless you've had your female organs removed, needs to be tested with a pregnancy test. I cannot tell you the number of surprises we have had for both myself and my patients, telling them, guess what? We know why you're nauseated, but you may not like the reason why. You are pregnant. So make sure you get your pregnancy test to find out what is going on. A second reason is that it could be a condition called gastroparesis or delayed gastric emptying. So what gastroparesis is that food typically go into your stomach and within 2 to 4 hours will be digested and move along. In gastroparesis, you have problems with digestion. Food just sits in your stomach and it sits there and it sits there and it sits there and you ferment, produce a lot of gas, and that can cause a lot of nausea to occur. Now, most gastroparesis patients will have diabetes as one of the risk factors for this. And in most patients who have gastroparesis, it'll be nausea and vomiting. So not just nausea alone, there'll be nausea and vomiting typically after you eat. So that's typically the spectrum you may have if gastroparesis is the cause for your nausea. Number 3 is marijuana. Absolutely. And I know you're like, no, marijuana doesn't cause nausea. It treats my nausea. And I'll tell you, if it's treating your nausea, why are you still nauseated, bro? Come on.
I'm talking about.
It's a very common misconception that marijuana is safe to take, doesn't cause problems, or doesn't cause issues. But I can tell you, literally every single day I see young kids smoking marijuana, doing a doobie, whatever it's called, and they're coming in because they are nauseated. And it's because of the marijuana. There's actually a condition called cannabinoid hyperemesis syndrome or cyclical vomiting syndrome. Same spectrum, same thing. It's not a big deal. But the root cause is nausea. What happens is the receptors that take in marijuana get upregulated inside your gut. In fact, this is one of the more common locations of those receptors. And so as you smoke marijuana, as you smoke more marijuana, you have more of the receptors getting developed inside your gut. And so during the periods when you're not smoking marijuana, what are your receptors doing? They want more marijuana. They want some more of that stimulus. And so it causes the symptoms of nausea. And so it ends up being a vicious cycle. You smoke marijuana to help with nausea. You get more nauseated because the receptors are upregulated. You smoke marijuana and more and more. It ends up being a vicious cycle. So yes, marijuana is causing your nausea. Number 4, it could be a condition called Crohn's disease. So Crohn's disease is part of the spectrum of inflammatory bowel disease or IBD. And with Crohn's disease, it can affect anywhere inside the gut. The colon, the small intestine, anywhere there. And so sometimes you can have a narrowing in the small intestine or inflammation that can cause nausea to occur as well. Now, typically you'll have other symptoms like diarrhea, weight loss, vomiting, other signs, but nausea can be a sign. And then number 5, very important, it could be outside your gut. Not everyone who's nauseated has a reason in the gut. I have to stress this to my patients. If you look under nausea and the causes in a medical book, it can be hundreds of different reasons and only a small fraction is in the gut. So I want you to keep in mind, we may not find the cause of nausea. Our goal is to see if there is a GI cause, but we may not be able to find the cause as well. Now, there are a lot of other causes, gallbladder, colon issues, things like that. But I want to go through the top 5. So what do I do in terms of workup for nausea? So one of the first things I do is I look at your medications. Are there medications you're on that can cause you to have nausea? Are there medications that slow the motility of your gut, cause gastroparesis, things like that? So I do take a good look at your medications. I look at pain medications, blood pressure medications, medications that are known to cause nausea. Number 2, I may take a look with what's called an upper endoscopy or an EGD. This is a small camera in which we put you to sleep. I take a look inside the upper GI tract to see if there's a cause for nausea in the upper GI tract. Is there an ulcer? Is there gastritis? Is there silent GERD? Who knows? I'll take a look and see what's going on. Number 3, I may do imaging of your gallbladder, whether it's an ultrasound or any other imaging. Number 4, I may end up getting a CAT scan or an enterography or an MRI of your gut so I can kind of see what's going on in this area. Is there a stricture? Is there inflammation? Is there signs of Crohn's disease or gastroparesis? This will give me a better idea of exactly what's going on. And then number 5, we'll do routine blood testing. Are your electrolytes low? Do you have hypothyroidism? Is that the cause? Are your cortisol levels out of whack? These are things that we kind of use to piece together why you are nauseated, and it's the diagnostic approach that I will take when it comes to nausea. And based on those initial findings, this will allow me to do more testing, more work to see exactly what's going on. So for example, if I see something on imaging, well, I may do further imaging. I may take a look and see what's going on. I may use a different scope. If I see an ulcer on the upper GI tract, I'll try to find out why do you have an ulcer, put you in ulcer treatment. What can we do to get that fixed and hopefully resolve your symptoms? So it's allowed me to kind of piece together why you're having these issues so we can hopefully find out what's going on. Now, this is just a superficial workup that we typically do. And once again, we may need further testing to find out exactly why you're having the things that we're seeing on these diagnostic tests. So even if we can or can't find the cause of the nausea, we still want you to feel better because nausea is not fun. I know it. I've had it. My wife's had it. A lot of people have it. So what can we do to at least treat your nausea? Here are 5 things that I recommend. Number 1 is ginger. Ginger has been used for centuries to treat nausea. It is such an effective option for nausea treatments. You can have this as ginger tea, ginger root, suck on some ginger, it doesn't matter, but ginger has an anti-nausea effect. Helps to relax the gut, relax the colon, decrease the receptors that are causing nausea to occur. This is why a lot of people have ginger ale when they're nauseated, because that ginger itself can help calm things down and get you feeling better. And not only does it work, it's been used for centuries to treat nausea. Tip number 2 is peppermint, especially if you have a lot of gut issues with that as well. So the peppermint that I recommend includes peppermint tea, peppermint gum, but also a peppermint capsule available over the counter called IB Guard. So what peppermint does helps to relax the gut, to calm things down, to help mitigate or minimize the rumbling and drumbling and all that stuff going on inside your belly when you're having the nausea. Not only does peppermint help out with nausea, it can also help out with GI issues like bloating, distension, and IBS. Number 3 is lemon. Oh yeah, lemon's great. I love lemon, and if you add lemon to your ginger tea, this actually may give you a nice, potent anti-nausea treatment. For some reason, the scent of lemon has been shown to help out when it comes to nausea. It can reduce those symptoms and get you feeling better. Number 4, bananas. Bananas are a very effective way to treat nausea. Bananas are gentle on your stomach. It helps to replenish some of the electrolytes you may have lost when you're vomiting, and also can get your nausea taken care of as well. Then number 5, certain spices are known to help minimize nausea symptoms. So fennel powder, for example, has been used to help out when it comes to menstrual symptoms and help people with nausea as well. Cinnamon may actually decrease the severity of the nausea episodes that you're having, so it's a very effective option to maybe add in some cinnamon to hopefully help relieve some of the nausea symptoms. Then lastly, cumin extract, which can not only help out with nausea, but also help out with gut issues like abdominal pain, bloating, distension, and symptoms like that. So I hope these tips were helpful for you when it comes to nausea. If you're having nausea, I'm so sorry. It's such a terrible symptom to have. But I hope this video gave you some reasons why, what you should ask your doctor what to do, maybe some tips to get you feeling better as well. Well, thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And don't forget to subscribe to my channel where you get more information so we can find out exactly what is going on.